Hi, I'm Nick Sireau. I'm the chairman of the AKU Society, and I wanted to thank you for this wonderful award we received from Cures Within Reach. So I'm going to tell you a little bit about AKU, also known as alkaptonuria or black bone disease, and also about the drug nitisinone that we have repurposed as a treatment for this terrible disease. So AKU was first identified 110 years ago as an inborn error of metabolism. And more than 110 years later, we're now at last approaching a treatment. AKU is known as black bone disease, and it's known as black bone disease because the bones go black and brittle. It's due to an enzyme deficiency leading to the accumulation of an acid called homogentisic acid. And that acid accumulates in cartilage and bone and goes black in a process called ochronosis. Now, until recently, there has been no treatment for this disease, and what this has meant is that patients have become steadily disabled as life progresses. So they've suffered from spinal collapse, the weight-bearing joints also start to collapse, they have problems with their heart valves, and it's a multi-systemic disease. It's also an ultra-rare disease. It affects 1 in 500,000 people, so very much on the ultra-rare side of the spectrum. Now, about 15 years ago, we started a partnership with the Royal Liverpool University Hospital under the leadership of someone there called Professor Ranganath. And Ranga, as we call him, has been an absolute pioneer in developing treatments for alkaptonuria, or black bone disease. So we've worked very closely with the Royal Liverpool University Hospital. We ourselves are a patient group. We represent patients with this disease, and we've raised funds to do two things. One is a clinical trial of this treatment nitisinone, and the other thing is setting up a national treatment centre up in Liverpool for patients with the disease in the UK. Now, the drug nitisinone is an enzyme inhibitor. This basically means that it stops the accumulation of the acid, the homogentisic acid that causes all the damage. It was originally developed as a herbicide a number of decades ago, and people realised that it worked in plants in the same metabolic pathway as in humans, and so through lateral thinking discovered that it could be used in alkaptonuria. And we have shown that in mice it completely stops the progression of the disease with some dramatic positive effects. And now we're just about to publish a paper showing that patients who've been on this drug for the past 4 years at our National Treatment Centre up in Liverpool have shown a dramatic reduction in the progression of the disease. So we're very hopeful about this drug. It was originally used for another disease called tyrosinemia type 1, very successfully, and it's a disease, tyrosinemia type 1, which is on the same metabolic pathway as alkaptonuria, and that's why it is a repurposed drug, because it's been used for another disease and we're now showing that it can be used for black bone disease. So we also have a clinical trial for our European patients, which lasts also 4 years, and we're about halfway through that trial, and we should hear hopefully very soon whether interim results, which are coming out before the end of the year, are positive or not, and whether we can then go ahead with approval from the European Medicines Agency. If the results are not positive, we will then go on for the full length of the trial to get a license for all our European patients. So thank you once again for all your work. Thank you in the name of my children who've got alkaptonuria, but also of all AKU patients around the world, and thank you for this award.